because I know you want to respond. On this issue of mandates, those who don't, whether it's 10 million or 15 million, those who can afford it but don't wind up buying health insurance for one reason or another, they wind up getting sick. They go to an emergency room. All of us wind up paying for their health care. That's the biggest criticism that's been leveled at your plan.
If people are gaming the system, there are ways that we can address that by, for example, making them pay some of the back premiums for not having gotten it in the first place. But understand that, number one, Hillary says that she's got enough subsidies. Well, we've priced out both our plan and Senator Clinton's plan, and some of the subsidies are not going to be sufficient. Point number one. Point number two is that I am actually not interested in just capping premiums. I want to lower premiums by about an average of $2,500 per family per year, because people right now cannot afford it. I can't tell you how many folks I meet who have premiums that are so high that essentially they don't have health insurance, they have house insurance. What they do is they have a $10,000 deductible or what have you to try to reduce costs. They never go to a doctor. And that ends up something that we pay for. So I'm trying to reduce premiums for all families. But the last point I want to make it has to do with how we're going to actually get this plan done. You know, Ted Kennedy said that he is confident that we will get universal health care with me as president. And he's been working on it longer than I think about than anybody. But he's gone through 12 of these plans, and each time they have failed. And part of the reason I think that they have failed is we have not been able to bring Democrats, Republicans together to get it done. That's what I did in Illinois to provide insurance for people who did not have it. That's what I will do in bringing all parties together, not negotiating behind closed doors, but bringing all parties together and broadcasting those negotiations on C-SPAN so that the American people can see what the choices are. Because part of what we have to do is enlist the American people in this process and overcoming the special interests and the lobbyists who are, Senator Clinton is right, they will resist anything that we try to do. My plan, her plan, they will try to resist. And the antidote to that is making sure that the American people understand what is at stake. I'm absolutely committed to making sure that anybody in America who needs health care is going to get it.
I just want to be precise, and I'll let Senator Clinton respond, but you say broadcast on C-SPAN these deliberations. Is that a swipe at Senator Clinton? Because
no, it's not a swipe. This is something that I've been talking about consistently. What I want to do is increase transparency and accountability to offset the power of the special interests and the lobbyists. If the drug companies or a member of Congress who's carrying water for the drug companies wants to argue that we should not negotiate for the cheapest available price on drugs, then I want them to make that argument in front of the American people, and I will have experts who explain that, in fact, it is legitimate for drug companies to make profits, but they are making outsized profits on the backs of senior citizens who need those prescription drugs. And that is an argument that the American people have to be involved with. Otherwise, we're not going to get any plan.
Senator Clinton, we remember in '93, when you were formulating your health care plan, it was done in secret.
Well, it was an effort to try to begin this conversation, which we're now continuing. It has been a difficult conversation. There have been a lot of efforts, and I'm proud that one of the efforts I was involved in 10 years ago resulted in the Children's Health Insurance Program. We now have 1 million children in California who every month get health insurance because of that bipartisan effort. We obviously are running into the presidential veto and not being able to expand it. But this issue is so important, and I just want to underscore 3 really critical points. First of all, I have said in my plan that we have to regulate the health insurance industry differently. We have to say to them that they can no longer deny coverage to anyone, and they have to cover everyone, including every pre-existing condition. And they have to compete on cost and quality instead of the way they compete now, which is to try to cherry-pick people and only insure the healthy and make it so costly for people with diabetes or cancer or some other chronic condition. Secondly, we've got to make it clear to the drug companies that they do deserve to be part of the solution, because we all benefit from the life-saving remedies they come up with, but we pay for it many times over. It is American taxpayers who pay for the research. It is American taxpayers who pay for a lot of the clinical studies. That's why while we're looking at getting to universal health care, we also have to give Medicare the right to negotiate with drug companies to get the price down, to begin to rein in those costs across the board. And finally, it is so important that as Democrats, we carry the banner of universal health care. The health insurance industry is very clever and extremely well funded. I know this. I had $300 million of incoming advertising and attacks during our efforts back in '93 and '94. And one of the reasons why I've designed the plan that I have put forward now is because I learned a lot about what people want, what people are willing to accept, and how we get the political process to work. And certainly, it is important that the president come up with the plan. But we'll have to persuade Congress to put all of those deliberations on C-SPAN. Now, I think we might be able to do that, but that's a little heavier lift than what the president is going to propose, because what happens is we have to have a coalition, and I think the plan I have proposed is if you take business, which pays the costs and wants to get those costs down, take labor that has to negotiate over health care instead of wages, take doctors, nurses, hospitals who want to get back into the business of taking care of people instead of working for insurance companies. I think we will have a coalition that can withstand the health insurance and the drug companies, and that's what I intend to do.